Now coming to the anatomy of the middle ear. The middle ear is kind of like a six-sided box. It has got six surfaces. And what are these surfaces? They are lateral and medial surface, the posterior and anterior surface, the roof and the floor. And we'll start with the lateral surface. The lateral surface, most of it is being covered by the tympanic membrane, which forms a partition between the external auditory canal and the middle ear. And a little bit above is being formed by the scutum. And this tympanic membrane, as you can see here, it is an angulation with the floor of the external auditory canal. This angulation is 55 degree. Okay, and this number 55 has got a significance in this case of tympanic membrane. What is that? 55 millimeter square is the effective vibratory area of TM. Okay, and what is the actual vibratory area of tympanic membrane? It is 90 millimeter square. So even though the area of the tympanic membrane, the total surface area of tympanic membrane is 90 millimeter square, the effective vibratory area is only 55 millimeter square. And this tympanic membrane lies at an angulation of 55 degree with the horizontal. Okay, now what are the features of tympanic membrane that you have to know? The tympanic membrane is pearly white in color, as you can see here, and it is semi-transparent. Because of that, you will be able to see the handle of malleus, which is lying just beside it. Okay, just medial to it, you have the handle of malleus attached to the tympanic membrane. This tympanic membrane, in fact, lies between the fibrous and mucosal layers of tympanic membrane. So from that you can know that it has got three layers. What are these three layers? It has got an epithelial layer, middle fibrous layer, and the inner mucosal layer. And this handle of malleus lies between the middle fibrous and inner mucosal layer. Okay, and you can see the lateral process of malleus here. Okay, so there are certain features that you have to learn in case of tympanic membrane. The tympanic membrane has got two parts, the pars tensa and the pars flaccida. The pars tensa is the tense part of tympanic membrane, and the pars flaccida is a flaccid part. Why is it called pars tensa? Because the fibrous layer, the middle fibrous layer, has got the various fibers arranged in a systematic regular manner, and because of that it is very tense. Whereas in case of pars flaccida, the middle fibrous layer has its fibers arranged in a loose irregular manner. Okay, and it is very flaccid and prone for retraction. Okay, now down you have the pars tensa, and in the pars tensa the fibrous annulus is thickened in the area where it is getting attached. And where is it getting attached? It is attached to the tympanic sulcus, and that area where it is thickened is what is known as the tympanic annulus. Okay, this is the tympanic annulus. Here you have the tympanic annulus. So it is seen only in the area of pars tensa, and it is thickened, and it will be difficult to elevate the tympanomeatal flap here. Okay, because of that thickening. Okay, now what else do you see? Sometimes you will be able to see the lenticular process of the ingus and the head of stapes and the footplate of stapes. All these shadows may be visible. Okay, and even the shadow of the round window niche also may be visible. Okay, so the things that may be seen when you see a tympanic membrane. Now the tympanic membrane, I told you, it has got three layers. What are these three layers? It has got the outer epithelial layer, middle fibrous layer, and in this middle fibrous layer there are both radial as well as circular fibers. Okay, radial as well as circular fibers. Now this outer epithelial layer is derived from the ectoderm. Okay, ectoderm, and middle fibrous from the mesoderm, and inner mucosal from the endoderm. I already told you the tympanic membrane is developing at the area of fusion between the ectodermal cleft and the tubotympanic recess, and that is why it is developing from all the three germ layers. Okay, all the three germ layers. Now this tympanic membrane, it is actually tended inward. Okay, because of the handle of malleus going inward like this, it is tended inward. Okay, this is kind of like this it will be, and this area where it is getting tended inward is what is called the umbo. Now because of this handle of malleus getting tended inward like this, there is a shadow, or rather a reflection. It's not a shadow, it's a reflection of light seen in the anterior-inferior quadrant, and that is what is called the cone of light. Okay, this is the cone of light that you see here. It is actually a reflection from the handle of malleus. Okay, handle of malleus, because of the inclination of the handle of malleus. Now, how do you identify the side of the tympanic membrane? What is this? What side is this? And what side is this? How will you identify? If you look carefully, you can see that the handle of malleus is pointed towards the right here, right? So it is at the point where the handle of malleus is pointing towards, that will be the side of the tympanic membrane. Okay, or when you can see the anterior-inferior quadrant properly like this, that is, when there is no perforation, you will be able to see the this anterior-inferior quadrant, the cone of light, right? If it is seen, you can say safely that that is the right, because it is pointing towards the right. And if the anterior-inferior quadrant is seen towards the left, then it is left. Okay, like that way you can identify. But when there is perforation, it is better to look at the handle of malleus. Look at where the handle of malleus is lying. Handle of malleus lies at the 1 o'clock position, 1 o'clock position in the right, and 11 o'clock position in the left. L for left. Okay, L for 11 and left. Okay, and 1 o'clock position in the right. So that's how you identify. So this is the handle of malleus, and you have the lateral process here, lateral process of malleus here, and there are two folds from the handle of malleus. Okay, what are they? They are the anterior and posterior tympanomallear fold. Okay, anterior and posterior tympanomallear fold, and above the anterior and posterior tympanomallear fold you have the pars flaccida. Below that you have the pars tensa. Okay, above the tympanomallear fold you have the pars tensa, and below you have the pars tensa, and above you have the pars flaccida. Okay, so these are the things that you have to know regarding the tympanic membrane. Now, which side is this? If you look carefully, you can see that handle of malleus is pointed towards left, and the quadrant, anterior-inferior quadrant, is seen here, right? The cone of light is seen here. So that is the left tympanic membrane. Okay, left tympanic membrane. Sometimes when there is a perforation, you will be able to clearly see this ingudocipitous joint, as you can see here. Okay, this is the lenticular process of ingus. Here there is no perforation, but because of the reflection, because of the semi-transparent nature of the tympanic membrane, you are able to see the lenticular process and the head of stapes. Okay, so this is the right TM, and here you have the tympanic annulus. Okay, the thickening of the pars tensa. Okay, that is called tympanic annulus. Here the fibrous layer is getting thickened. Okay, and it is also known as Gerlach's ligament. Okay, Gerlach's ligament. What do you mean by Gerlach's tonsil? Gerlach's tonsil is actually the tubal tonsil, about which you will be learning later on when I am talking to you about adenoids and all those areas. You will be learning about it, but for now just learn that Gerlach's ligament is the tympanic annulus. Okay, tympanic annulus and Gerlach's ligament are both the same. Okay, so these are the things that you see in case of a tympanic membrane, and this is another session. This is a sagittal session of the tympanic membrane that you can see here. Oh, sorry, it's a coronal section. Okay, not the sagittal, it is a coronal section, and when you take the coronal section like this, you will be able to clearly see the annulus. This is the tympanic annulus or the Gerlach's ligament, and you can see the umbo here. Okay, the pars tensa is tended inward like this, and this is the umbo. Okay, now this is the ingus and the stapes here, and you have the malleus here. Okay, so that's it about the tympanic membrane. Now, what do you mean by scutum? The word meaning of scutum is shield. Okay, shield. This is the shield of Captain America, right? So, scutum means shield, and the scutum is like a shield in the area of the epitymphanum. Just lateral to the epitymphanum, you have the shield formed by the scutum, and the scutum, it is eroded in case of an epitympanic cholecystioma. Okay, so this is a telltale sign of pars flaccida cholecystioma, and it will be seen easily in the coronal section of the CT. Okay, when you take an HRCT temporal bone, when you are suspecting cholecystioma, you have to look at the coronal section and look at the scutum if it is eroded or not. Okay, now this scutum, it forms the upper part of the lateral surface, as I already told you. And what is it? Scutum is the outer attic wall. Okay, this is the attic. Okay, the area above the mesotymphanum. Mesotymphanum lies just middle to the tympanic membrane, and the area above it is the epitymphanum, right? And this area above it has got a scutum on its outer wall. Okay. Now, what is the answer to this question? Conoflight is due to malleolar of fold, handle of malleus, anteroinferior quadrant, or stapes. I already told you it is due to the reflection of the handle of malleus. Okay, reflection of the handle of malleus. The anteroinferior quadrant is being seen, but why it is formed, if you ask, it is due to the reflection of the handle of malleus. Okay. Now, on the medial part of the lateral surface, you have the posterior canaliculus, through which the chorda tympani enters the tympanic membrane, goes between the middle fibrous and inner mucosal layer after passing between the malleus and ingus, and then comes out through the anterior canaliculus. Okay, it comes out through the anterior canaliculus to supply the anterior to the left tongue. Okay, so that's about the medial surface of the lateral surface, that is the medial part of the lateral surface. Okay, and if you are elevating the tympanomeatal flap, you will be able to see the medial surface like this. Now, the most mobile part of the tympanic membrane is central, peripheral, both, or none of the above. In the center, you have the area, the hand of malleus attached to the tympanic membrane, so it will be less mobile. And in the most peripheral part, it is attached to tympanic annulus and to the tympanic sulcus, right? So that also will not be very mobile. It is actually the paracentral area which is the most mobile, but in this question you can write it as peripheral because it is more mobile compared to the central area. Okay, so that is the answer to this question. Now, what is the scutum? Scutum, I already told you, it is the lateral wall of attic. Which lateral wall? It is the anterolateral wall of attic, which is known as the scutum. Okay, the anterolateral wall of attic is called the scutum. Okay. Now, coming to the medial wall of Midlia, the most prominent structure that you see on the medial wall of Midlia is the promontory. Okay, promontory is the most prominent structure that you will be seeing on the medial wall of Midlia, and it is being formed by the basal turn of cochlea. Okay, promontory is being formed by the basal turn of cochlea, and above the promontory you have the oval window, which is in fact not seen in real life because it is being covered by the footplate of stapes. And postero-inferiorly, you have the round window. Okay, you have the round window over here. So this is the oval window, and this is the round window. Okay, and this is the promontory. And what else do you have on the medial wall of the midlia? On the medial wall of midlia, the next thing you have is a very important structure, which is the facial nerve, and it is seen in a canal known as the fallopian canal. It goes on like this. Okay, and so here it forms the tympanic part of the facial nerve. Okay, tympanic part of facial nerve is seen in the medial wall of the middle ear, and the vertical part of facial nerve is seen in the posterior wall of the middle ear, and it is also known as the mastoid part. Okay, it is also called the mastoid part. Okay, so this is how the facial nerve is seen, and this facial nerve, it forms a bend over here, isn't it? This bend, it is what is called the genu. The first genu is seen here. Okay, and it is in the area of the first genu that you have the geniculate ganglion, which is the ganglion of the facial nerve. Okay, the ganglion of the facial nerve is in the area of the first genu. Okay, and it is from this genu. The word meaning is bent. Okay, you might have heard about genu varum and genu valgum in ortho, isn't it? And yes, it implies knee joint because it is an area where you have got a bend. Similarly, there is a bend over here, isn't it? So this is the area of genu of facial nerve, and there is a second genu over here. Okay, this is the second genu. Okay, and you will be learning about all these things when I teach you anatomy of facial nerve in a separate class. Okay, it requires more details. And for now, just remember how the facial nerve is running through the medial wall of the middle like this. Okay, and just above the medial wall of middle you have the lateral semicircular canal or the horizontal semicircular canal like this. Okay, horizontal semicircular canal, and this horizontal semicircular canal is getting stimulated when you have a caloric test being done. Okay, and it is this horizontal semicircular canal that is responsible for vertigo when a syringing is being done. Okay, when the syringing is not done in the body temperature, you might notice the patient having vertigo, and this is because of the stimulation of the lateral semicircular canal. Okay, so here you have the lateral semicircular canal, and yes, you have another very important landmark for the genu here. What is that? That is the process cochleariformis. Okay, this process cochleariformis is a hook, and it is on this hook that the tensor tympani muscle bends. Okay, the tensor tympani muscle is coming from the anterior wall. Okay, this is the anterior wall, and it is from here the tensor tympani comes actually quite nearer to the medial wall. Okay, and it will be seen almost like this. Okay, and it is from here it goes like this, and then it bends so that it goes and attaches to the handle of malleus. Okay, it goes and attaches to the handle of malleus. So this is how it goes. This is the tensor tympani muscle. It bends over the area of processus cochleariformis and goes on to attach to the handle of malleus. Okay, so these are the various landmarks that you see here. You have the processus cochleariformis over here. Processus cochleariformis is the landmark for genu. Then there is another landmark for genu that is actually coming from the tegmen tympani or the superior wall. Okay, from the superior wall comes a crust of bone downwards, and that is what is called the cog. Okay, cog is another landmark for genu. Okay, it will be coming like this. Okay, this is called cog. Okay, so this cog is not seen on the medial wall of mid-ear. I just told it for the completion's sake. Okay, it is actually seen in the epitympanum area, and it is actually causing the division of epitympanum into two separate spaces. Okay, you need not know the details of all these things, but you just have to know that cog is another landmark for genu apart from the processes cochleariformis. So the landmark for the first genu or the geniculate ganglion are processus cochleariformis and the cog. Okay, so the two landmarks for the genu, and you have the landmark for the tympanic segment in the form of lateral semicircular canal and the oval window. Okay, lateral semicircular canal and the oval window. And so these are the major structures that you have to learn in the medial wall of mid-layer. You have a promontory over here, which is formed by the basal turn of cochlea, and actually from the promontory there are two projections that are arising. That is also something you have to learn. Okay, what are these projections? One projection goes into the pyramid. Okay, pyramid is seen in the posterior wall of the mid-layer. The second projection goes inferiorly into the styloid eminence. Okay, you need not know what the styloid eminence is, but just remember it is going downwards to the area of the round window. And yes, this promontory gives of these two prominences, which are very important that you remember its name, and they are pondiculus and the subiculum. Okay, pondiculus and subiculum. So this is the pondiculus, and you have the subiculum over here. Okay, so this is the subiculum. You have the pondiculus. So these are getting projected from the same promontory, isn't it? Now, what is the significance of these projections? It means between these projections, a space is seen on the medial wall of mid-layer, and that space is very important because it is an area where most commonly the residual polysteatoma is seen. And what is that space known as? That space is known as sinus tympani. Okay, that space is known as sinus tympani. So here you have the sinus tympani. Okay, so that's about the oval window and round window. And so these are the various structures in the medial wall of mid-layer. Now, what is the word meaning of this promontory? Promontory is actually a high land that projects onto the sea. Similarly, it is forming a projection, isn't it? So, what are the major structures that you see on the medial wall of mid-layer? On the medial wall of mid-layer, you can see the major structures such as one is the promontory, and from promontory arises the two projections called pondiculus and subiculum. Then you have the oval window and round window, and you have the facial nerve, you have the lateral semicircular canal, you have the processus cochleariformis. Now, have I left out anything? And of course, the sensitive muscle is actually curving around the area of the medial wall. Okay, that is because the process cochleariformis is forming a hook around which the thing curves around. After coming from the anterior wall of the mid-layer, the density muscle curves around on the process cochleariformis so as to go on and insert to the handle of malleus. Okay, it goes on to insert onto the handle of malleus. Okay, now coming to the various structures on the anterior wall of mid-layer. The anterior wall is also known as carotid wall. Why? Because the internal carotid artery is forming a relation with the anterior wall of the mid-layer. Okay, the anterior wall, we already told you there is the tensor tympani muscle coming like this, and inferiorly you have the eustachian tube opening. Okay, here you have the eustachian tube opening, and then what else do you have? There is one more opening which is seen laterally. Okay, this lateral opening is the anterior canaliculus. Okay, it is the anterior canaliculus, and this is also known as canal of Huggier. Okay, canal of Huggier. So on the anterior wall you have three structures. Okay, one is the Eustachian tube. Two, you have the canal of Huggier, and it's through the canal of Huggier the chorda tympani comes out. Okay, this canal of Huggier is in fact a part of the Glaserian fissure, and in the Glaserian fissure you have the anterior malleolar ligament. Okay, and this canal of Huggier is actually seen on the Glaserian fissure, and it is through this canal of Huggier or the anterior canalculus that the chorda tympani nerve comes out of the middle ear and goes on to supply the anterior two-third of the tongue. Okay, anterior two-third of the tongue, and then you have the tensor tympani tunnel. Okay, so these are the structures that you see on the anterior wall. Now on the posterior wall, what are the structures that are seen? Let's see. This is the posterior wall. Okay, the posterior wall. Superiorly, you have the adductus opening. Okay, it is through this that the mastoid is connected. Mastoid aerosol system is connected with the middle ear. Okay, it is through this opening that the mastoid aerosol system is connected with the middle ear, and this is called the adductus. And just below that, you have the fossa incudis. Okay, fossa incudis, and it is on the fossa incudis you have the short process of ingus seen. Okay, short process of ingus is getting lodged on the fossa incudis. Okay, this is the fossa incudis, the adductus. Okay, now what else do you have here? Here you have one more opening, the opening through which the chorda tympani enters the middle ear. Okay, the chorda tympani has to enter the middle ear before it gets access. Okay, before exiting the middle ear, it has to enter, right? How does it enter? It enters through a gap between the lateral wall and the posterior wall, and that gap is known as the posterior canaliculus. Okay, posterior canaliculus. Okay, this is arising just before the facial nerve exits through the stylomastoid foramen. Okay, this is the stylomastoid foramen over here, and if this is the facial nerve, you will have the chorda tympani coming like this. Okay, so the facial nerve coming out through the stylomastoid foramen. The chorda tympani is coming out just before it exits the stylomastoid foramen, and it comes out through the posterior canaliculus. Here we have the anterior canaliculus. This is the posterior canaliculus. Okay, so this is the posterior canaliculus, and here we have the anterior canaliculus, and this anterior canaliculus is also known as canal of Huggier. Okay, so you see that there is a space between the chorda tympani nerve over here, which is coming out to the posterior canaliculus, and the facial nerve, and superiorly you have the fossa incudis. This space is what is known as the facial recess. Okay, facial recess. This is the area which forms a window through which the middle ear can be accessed. Okay, through the posterior wall of the middle ear, which is having the mastoid aerosol system behind it. If you have to access the middle ear, what you do is you have to go through the facial recess, and with this facial recess approach, you can go into the round window. Okay, if you go through here, you can see the round window very clearly, and through the round window, you can insert a cochlear implant into the round window. Okay, so that is the significance of knowing this anatomy in detail like this. Okay, so that's about the posterior wall of the middle ear. Now you can see how the chorda tympani nerve comes through the posterior canaliculus. Okay, this is the posterior canaliculus. It goes through the middle ear between the handle of malleus and the ingus, long cross of ingus. It goes like this, and then it goes between the middle fibrous and inner mucosal layer. Okay, chorda tympani is actually transversing the whole of the middle ear. It goes between the middle fibrous and inner mucosal layer, and then it comes out to the anterior canalicus. This is also known as canal of Huggier. This is in fact a part of the Glycerian fissure. Okay, Glycerian fissure or the petrotympanic fissure. Glycerian fissure or petrotympanic fissure. And this petrotympanic fissure or Glycerian fissure, in addition to this, contains the anterior tympanic, anterior malleolar ligament. Okay, anterior malleolar ligament, which is connected to the malleus and anterior process of malleus. Okay, anterior process of malleus and the anterior malleolar ligament are seen in the Glycerian fissure. Okay, so these are the various structures on the anterior as well as posterior fold of the middle ear. Now coming to the lower part. Okay, on the lower part, what do you have? What else do you see here? I drew the picture of facial nerve here because there was no space. It is not seen in the floor of the mid layer. Okay, this also you can delete because I don't want you to have any confusion regarding that. The facial nerve exits through the facial nerve is exiting through the stylomastoid foramen, and as it exits, is giving the branch called chorda tympani nerve. Okay, and this chorda tympani nerve supplies the anterior two-third of the tongue. Okay, anterior two-third of the tongue. Now, before going to the rest of the anatomy of the uh, middle ear, I forgot to mention one very important structure in the posterior wall of the middle ear. It forms a important relationship of the facial nerve. What is that? That is in fact the pyramid. Okay, pyramid, and this pyramid is seen closer to the medial wall of the middle ear. Okay, it's seen closer to the medial wall of middle ear, and this structure gives out a structure which is called the stapedius tendon. Okay, the stapedius tendon goes on to insert to the neck of stapes. Okay, neck of stapes. The stapes is having a head, neck, crura, and foot plate, and this thing goes on to insert to the neck of the stapes. Okay, so that's it about the anatomy of the medial wall, anterior wall, and the posterior wall. Now coming to the floor of the middle ear. On the floor of the middle ear, you have the jugular bulb. Okay, the jugular bulb over here, and this jugular bulb is formed by the sigmoid sinus. Sigmoid sinus seen in the posterior wall, right? And the sigmoid sinus, after coming through the posterior wall, it goes on like this and then forms the jugular bulb over here. Okay, so this is the sigmoid sinus. Sigmoid sinus forms the posterior relationship of the mastoid. It's in posterior to the mastoid, and yes, you have the sigmoid plate which protects the mastoid from the sigmoid sinus while drilling. Okay, if you go beyond the sigmoid plate, you will accidentally tear the sigmoid sinus. Okay, so the sigmoid sinus goes on to continue to form the jugular bulb over here. Okay, jugular bulb, and from the jugular foramen arises a nerve which is very important. It comes up like this and then goes onto the promontory and forms a plexus over here. Okay, this nerve is known as the tympanic branch of facial nerve. Okay, tympanic branch of facial nerve, and it forms a plexus on the promontory along with the superior and inferior caroticotympanic nerves coming from the anterior wall of mid-layer. Okay, anterior wall of mid-layer, you have the superior and inferior caroticotympanic nerves coming, and it goes on to supply the promontory, and it forms a tympanic plexus along with the tympanic branch of the glossopharyngeal nerve. Okay, so this tympanic branch of glossopharyngeal nerve, what is the other name of tympanic branch of glossopharyngeal nerve? It's also known as Jacobson's nerve. Okay, Jacobson's nerve. You might remember this New Zealand cricket player Jacob Oram. Okay, you can see how Jacobson is there. That is, son of Jacob is sitting near him, isn't it? So this is Jacobson's nerve, and this Jacobson nerve is actually supplying the medial wall of tympanic membrane. Okay, the lateral wall of tympanic membrane is being supplied by the auricular temporal nerve anteriorly and posteriorly by the Arnold's nerve. The medial wall of the tympanic membrane is being supplied by the Jacobson's nerve. And this Jacobson's nerve is in fact responsible for the nerve supply of the mid-layer as well. Okay, over the promontory it is forming a plexus called tympanic plexus and it supplies the whole of the mid-layer. Okay. So Jacobson's nerve forms the tympanic plexus over the promontory. Okay. So these are the various structures that you see on the anterior wall, medial wall, posterior wall, and the floor.